Hi, this is Dr. Kevin Smith. Thank you very much for checking out this video and hidden secret number 17 of why you can still have back pain. In this video, the problem is due to a condition called spondylolisthesis. A spondylolisthesis is a forward slippage of a vertebrae that causes pain due to pressure on the nerves that exit the spine. The spine is composed of 24 movable vertebrae. You have 7 cervical, 12 thoracic, and 5 lumbar vertebrae. And they function like a stack of blocks or like a Jenga tower. And if you have everything lined up correctly, you have minimal amounts of stress and strain on the spine itself, on the joints, on the discs, and on the soft tissue structures like the muscles and tendons, on the ligaments, and also on the delicate spinal nerves that exit the spine. If you have a misalignment in the spine, either a forward or backward or rotatory misalignment, meaning it's rotated left or right, or it's tilting left or right, that's going to cause abnormal loading on the spine. It's also going to cause pressure on the spinal nerves and lead to pain. Now, a spondylolisthesis is where you have one of the vertebrae that is slipped forward compared to the one above or below it. This forward slippage could be caused by a couple of different things. It could be congenital, meaning it happens from birth. It could be developmental, meaning that just the way that the child grows, it causes the vertebrae to slip forward with no known reason or cause. And it could be due to trauma. It could be due to a one-time trauma or repetitive stress. We see spondylolisthesis a lot in gymnasts, and we see it a lot in cheerleaders. And these girls are doing all kinds of tumbles, and they're constantly falling and creating trauma after trauma after trauma, and that causes the vertebrae to slip out of alignment. And then years or decades later into life, they've got chronic nagging, ongoing back pain, and they just can't figure out what may have caused it. In order to diagnose a spondylolisthesis, we have to take an x-ray of the spine. And this diagnosis is generally a side view of the spine. And what we do is we take a look at the alignment of the vertebrae. And if you see a vertebrae that's slipped forward, there's a spondy, that's going to cause problems. And that's actually present in approximately 25% of the population. So it's actually pretty common. It's a very common problem, and what's the best way to fix this is to focus on restoring proper motion to the joints and the muscles, keeping your spine aligned correctly, and then strengthening and stabilizing the spine through corrective exercises, with a very strong emphasis on that last part. Strengthening and stabilization exercises are absolutely essential for somebody that has a spondylolisthesis in their back. And by restoring motion, alignment, and strength, you have the best chance of staying pain-free. I hope you enjoyed this video, and I hope you learned something. If you have any questions about spondylolisthesis or back pain, please feel free to communicate with me through my website at redapplewellness.net. Please also subscribe to my YouTube channel and tell a friend. And again, thank you very much for checking out this video.